Okay, everyone, it's 5 o'clock, so we're going to get started. If you've joined these seminars, the seminar series in the past, you know me, I'm a familiar face. If not, for anybody new that's just joined us tonight, my name is Antonio De Rosa. I'm on the faculty at Weill Cornell. I have a dual role. My first is in the Samuel J. Wood Library on the clinical services team. My other role is with the Meyer Cancer Center's Office of Community Outreach and Engagement, running their program on decision navigation and patient support. So a couple housekeeping items before we get into tonight's talk. For questions, please use the Q&A feature at the bottom of the screen. It just says Q&A all the way at the bottom. Feel free to type those in as we go through, as Dr. Gupta talks. We'll be having ample time at the end to field those questions and for her to address anything specific that you may want to ask. This is being recorded. Also, I want to make sure everyone knows that. It'll be made available online for later viewing. We'll post it up to YouTube, and I'll be sharing out the link with everyone who registered for this talk shortly after it's over, some point tomorrow, most likely. Okay, so what you're all here for. Let's get a little bit, just to give you a little bit about Dr. Gupta. She's an assistant professor of medicine at Weill Cornell, and she's the co-founder and co-director of the Integrative Health and Wellbeing program at New York Presbyterian. She spent the last several years examining national and global advances in integrative healthcare. Her interest in integrative and internal medicine began at a young age and is rooted in the concept of food as medicine. She believes that prevention and a healthy lifestyle should be at the forefront of healthcare, and she works to bring these principles into practice. So with that, I'm going to turn it over to you, Dr. Gupta. Take it away.
Thank you so much, Antonio. And thanks everybody who's on for tuning in. I am really looking forward to the next hour, explaining a little bit about my background and philosophy when it comes to healthcare, and also learning from you and answering your questions as best as I can at the end. A little bit about me. I grew up with immigrant Indian parents, and I've always considered myself a bit lucky because I grew up with the idea that the way that we live every day, everything that we eat and we drink, how we move, how we deal with everyday challenges, how we sleep, that all of those things impact our health today, but also longer term. I did find that at some points in my training, some of these things were not being emphasized as much as I wanted them to be. And so as a result, I was taking care of patients, for example, after heart attacks in the hospital. I would see them get served not great, heart-healthy foods afterwards. And when they would ask me what they could do to decrease the likelihood that this happens again, I just wasn't able to provide that deeper level of care that I really wanted to. Likewise, I would see people struggling with anxiousness, mental health, and just generally not feeling well, and I wasn't able to guide them in the way that I wanted to. So from there, it was really just a lot of self-learning and kind of teaching myself as a physician what information is out there, and then arming myself with the tools so that I could educate people that I was working with. Some people see this term integrative health or integrative medicine, and there are a lot of different connotations and a lot of different terms out there. So I just wanted to take a moment to clarify some of those just up front. Integrative health is very different from alternative medicine, which became quite popular in the US back in the 60s and in the 70s, when people were seeking out non-evidence-based care in place of standard of care. Now, we've known for a long time that that does not lead to good outcomes and good health at an individual level. So from there, complementary medicine became more popular, where a person may go to a certain place for their primary care, and maybe they see a neurologist there to help treat their migraines. And then maybe they go somewhere else over here to learn meditation or for acupuncture, for example, or massage therapy to treat the muscle tension that leads to those headaches or those migraines. Now that's better than alternative medicine because we're not abandoning standard of care in place of something else. But the problem there is that sometimes care can be a little fractured or disjointed, and there often isn't great communication between those sets of providers. So in integrative medicine, what we aim to do is bring in evidence-based therapies into the same place that you would seek out the rest of your care so that you can get that benefit early when it's appropriate and also with some oversight of your medical team. So with that, let's start talking about what you're all here for, which is stress and sleep. Now you might have heard of these terms before, rest and digest, or fight or flight. You might even be able to remember or recall the last time that you were in these two states. The way that I like to think about this is your nervous system basically has two components. We have our conscious nervous system, and that is what tells me that, okay, I'm going to now pick up this pen, or I'm going to stand up and walk out the door. And then we have our subconscious nervous system that we don't have to think about constantly. That subconscious nervous system is also called our autonomic nervous system, and we can think about it as our automatic nervous system. Now that automatic nervous system has two flip sides to that coin. One is this restful, more relaxed state when our bodies are designed to undergo those more recuperative, more restorative, more restful functions, such as digestion, for example. That's why we call it rest and digest. But the other side of that coin, what we call fight or flight mode or survival mode, or that feeling that you might experience when you're on all day or you're thinking go, go, go all day, is shown on the right. And now that fight or flight system, it's interesting to think why it evolved. We have that to get us out of threatening situations. Traditionally, we're talking about life-threatening situations. But if I asked you to recall the last time that you felt your heart pounding or your blood pressure going up or yourself feeling jittery or nervous for a few moments, if you were in a life-threatening situation, or in a less threatening situation, but one that was uncomfortable or that you didn't like. What we're seeing is now we're kind of flipping over into this fight or flight mode, even in non-threatening situations where maybe you have a phone call that you're not happy about, or you receive an email that you don't like, or you have a conversation that you don't like. And that's not a problem if we're in fight or flight mode for a couple of minutes or even hours or even days. But the problem occurs when we're in fight or flight mode week after week, month after month, year after year, and that's when it can really start to have impacts on our wider health. People are always curious about how this works. So I find explaining a little bit helpful. In the rest and digest mode, that autonomic nervous system, you can see it's housed here, actually communicates with a lot of our different organs and sends those organs and systems signals that allow them to undergo that repair or allow them to focus on that function. Now you might notice that a lot of them have to do with digestion. That's why it's called rest and digest, because in this mode, the activity of our stomach, our gallbladder, our intestines, all of that is enhanced or optimized. On the other hand, in fight or flight mode, we innervate other organs, and you might recognize how these things work. So through sympathetic nerves, or those fight or flight nerves, our heart rate can go up, our blood vessels can constrict, so our blood pressure goes up, and you'll see it actually inhibits digestion. One thing I see a lot of in my practice is irritable bowel syndrome, where, which is an extremely multifactorial problem. And being in this chronically stressed or worried or anxious or fight or flight mode, whatever we want to label that, can really be a problem for this sensitive system of digestion. And that's why we see this chronic stress often impact digestion first. Now, when we're talking about stress, many times we're actually we refer to it in an external sense. We tend to think about stress as, okay, that work situation is stressful, or that relationship is stressful, or that thing that just happened is stressful. But when I'm talking about stress, or we're talking about stress, we're really talking about it in that medical sense that you saw here. And as I mentioned, the chronicity is really the key. When we've been in that fight or flight mode for long periods of time, we see it impact many different domains of health. One that we know a lot about is pain. It can actually directly amplify and increase pain signals on the way that we perceive pain if we're constantly or frequently experiencing negative emotions like fear, sadness, anxiousness. Is there anyone here who has not noticed the impact of stress on sleep? I certainly have. It can impact a lot of affective disorders, things like anxiety, depression. It can certainly impact energy. It impacts weight. So when we are constantly activating our stress hormones, such as, let's say, cortisol in our body, those hormones actually signal our body to store energy, and we store that energy as fat, specifically around our organs in our abdomen. Now that correlates with risk of cardiovascular disease. So this is a really important one to be aware of. We already spoke about how it can impact digestion. Have you ever noticed that if you're very stressed out for long periods of time, maybe you get sick more frequently? And that's because it decreases your immunity. So if you're constantly in that fight or flight mode, you're more likely to catch something than somebody who's not. It can impact blood sugar, heart disease, and even cognitive function. So let's talk about one or two of these just to take a deeper dive. Now, on the left in green, you can see what your brain looks like when you're alert and in that rest and digest mode. The way you can think of this diagram is like if I'm turned to this side, this area in green is the front of your head, so it's right behind your forehead. That's called your prefrontal cortex. And back here, that's going to be the back of your head. Up here behind your forehead, that prefrontal cortex is responsible for kind of what makes us human. It's the most recently evolved area of the brain that allows us to regulate things at a higher level. It allows us to regulate our thoughts. It allows us to regulate our emotions, as well as many other things. Now, when we're in that alert and relaxed mode, that area is functioning well. You can see it's in green, and it is communicating with lower down areas of the brain seamlessly. On the other hand, this is your brain on stress. And again, not stress for like a couple of minutes or an hour or a short period of time or in an appropriate situation. We're talking about when we're constantly activating those anxious or stress networks. This is what happens. Instead of activating this prefrontal cortex, this more highly evolved area of the brain, we actually activate the more primitive areas of the brain. The amygdala is one of these, and it's basically located kind of inside your ears. And that's also the area that's activated when we're experiencing other negative emotions like fear or even low mood, feeling depressed. And when we activate these, we literally are sending negative signals to the prefrontal cortex saying, hey, that's not important right now. Right now I'm in survival mode. So instead, we should be sending signals down to our autonomic nervous system that we just learned about, sending us into fight or flight mode, increasing our heart rate, increasing our blood pressure, increasing tension in our muscles so that we can get away from that life-threatening situation. And that's how that works. We literally call these parts of the brain our monkey mind because they've been around for a very long time. Interestingly, I mean, this sounds like doom and gloom, but it's not. Interestingly, what we see in people who practice mindfulness meditation on a regular basis, so pretty much every day, we see that some of these structural and functional changes can actually reverse. So we actually see that in many of those people's minds, the prefrontal cortex becomes more active, it becomes better connected, and these lower down, more primitive areas of the brain actually may shrink in size and they get less well connected. In fact, even an area of the brain that's important for short-term memory, called the hippocampus, actually grows in size, which is pretty incredible. These are really profound structural changes that we just can't replicate in any other way right now. There's an interesting study I may have mentioned a few slides ago that stress can actually impact aging. This is a small study that looked at a group of women between 20 and 50 years old. And in order to determine that level of stress, or to get their kind of control group, they looked at mothers of a chronically ill child who required a lot of attention, a lot of care. And then they also looked at mothers who did not have that scenario, and they used those mothers as a control. It was a very small study, but the findings were interesting. They asked those moms, how stressed do you think you are? So this is something that that person experienced. And then they looked at telomere length and telomerase activity. Telomere length, this is a chromosome or part of your DNA. And on the ends of your DNA, you have these caps called telomeres. If you think about a chromosome as a shoelace, there's that plastic cap on the end that keeps that from unraveling. Telomeres do something very similar for DNA. And then telomerase is the enzyme that creates telomeres. And what they found is that in the caregivers, they reported higher amounts of stress, and they found that the telomere length and also the activity of the enzymes that creates telomeres was actually correlated with that. Not only was it correlated with that, but the chronicity of that stress, the duration of that stress, was actually directly correlated as well, not just the fact that they were caregivers. And that was even after they controlled for the difference in ages in the moms, after they accounted for differences in weight and body composition. They found that the higher stress group had shorter telomeres. So again, a small and early study. There have been a couple of others that show corroborative findings, but I think there's a lot of promise there. So what can we do about it? Awareness is always going to be the first step. So until we're aware of how we're responding to our external surroundings in any given moment, it's impossible to make a change. So that is always going to be the first step. Awareness, so I've also mentioned mindfulness or meditation once already. Sometimes these words can be a little scary or a little bit out there if you're not open to it or if you haven't tried it or experienced it in the past. But mindfulness is just another word for awareness. And in a mindfulness practice, all we are trying to learn or teach is helping each person gain an insight into how they're responding subconsciously, that automatic nervous system, to everything in their surroundings. Other helpful tricks, it's really important to have somebody that you can talk to. It's great if you can have somebody that you can talk to in your personal life, like family member, a friend, a colleague, an acquaintance, but also having somebody professional to talk to might be helpful. So somebody like a therapist or a counselor sometimes makes sense. Even just by taking a deep breath in and then slowly letting it out, even that flips your subconscious nervous system out of fight or flight mode and into rest and digest mode. Just by taking a deep breath in and then a long exhale. So within a couple of seconds, you can get yourself feeling better if we've realized that we've flipped over into fight or flight mode. Being active, so doing a quick workout. Sometimes I'll just do like 10 push-ups or something quick. It's a great way to blow off steam. Getting outside to do that is even better, especially right now when we're all spending more time indoors. It can be easy for some of us to spend day after day without even leaving the house or the apartment. So do try to make it outside, preferably early in the day if possible. Many people find acupuncture very helpful. Acupuncture has been studied in a lot of different contexts, including pain, and many people also find it helpful for stress and also for sleep. And yoga right now is kind of a loaded term because you can find a whole host of different types of yoga practices these days, which I think is great. But the initial practice of yoga really focused on the connection between breath and movement. So even you can do yoga in a chair. You can do yoga in you can do like 10 seconds of a yoga practice, and that still counts. And what we're doing there, again, by focusing on the breath and linking it to movement, is also bringing awareness to our being and also to our movement. The more aerobic forms of yoga that you're seeing in studios and gyms are also great, but also not necessary if you're interested in starting. And I did want to mention a specific mindfulness or meditation course because I consider it to be almost the gold standard for learning mindfulness, especially here in the Western part of the world. There's a standardized class called the MBSR program, Mindfulness-Based Stress Reduction Program. That's really made up of 3 components. It is basically an 8-week class, a group setting. A lot of people, including us, are right now doing it virtually, but also in person is nice because you're seeing the same faces every week. The group meets for 2 hours. For 8 consecutive weeks. And then there's also usually a retreat or a practice day built into the second half of that. And using those 8 weeks and using your peers, you identify barriers that are getting in the way of basically you implementing or learning your own mindfulness or meditation practice. It's not for everybody, but it really is a hefty commitment. But I have had many patients, friends, colleagues who have gone through this class and really found it transformative. There are also quicker and easier ways to learn. There are a lot of virtual resources, a lot of online resources. So it's important to choose the tool or the skill that's right for you. Let's spend a couple of minutes on sleep. You may have noticed, even from personal experience, that sleep impacts a lot of different areas of health. It can definitely impact immunity. So if you're, similarly to stress, if you're going day after day, week after week, getting not enough sleep, which for most people is somewhere between 7 and 8.5 or 7 and 9 hours of sleep per night, that can really impact your immunity. It can impact mood. Many people find themselves more irritable or easily annoyed after not getting enough sleep. Likewise, energy. I bet almost all of us, or probably all of us, have noticed the impact of lack of sleep on energy. Sleep is also a really important time for consolidating memory and consolidating learning. So without adequate sleep, we tend to learn less effectively. It also impacts libido and also metabolism. So your sleep and your cortisol rise and your blood sugar rhythm are all related. And through mechanisms like that, lack of sleep can also promote weight gain. For example, when we are sleep deprived, like let's say I only get 6 hours of sleep tonight, tomorrow morning, my body will tell me that I need more energy. And I will, without consciously realizing it, look for something that is energy dense. So typically a refined carbohydrate or something that is sugary, or like breads or pastas or rices or oats or things that are really dense in energy. Now those aren't necessarily bad things, but it's when you're really hungry or craving energy, it's a lot easier to pick something like the scone or the cupcake or the bagel than it is to pick the healthier, more complex option. A lot of things contribute to poor sleep. Sometimes it's situational things like work, for example, or something in the home that keeps you busy until later. Sometimes it's increased stress response or anxiousness. These days, digital devices are following us everywhere, and spending time watching TV until you fall asleep, or on your phone or on a tablet or a computer, all of those things emit short wavelength light, which basically signal to your brain not to release melatonin, which is an important hormone that induces sleep, and that can keep you awake. Also, just the content, right? We're very constantly consuming content these days through media, through social media, through other means, and that is quite stimulating when you're going to bed. Nutrition has a big impact on sleep. Eating large amounts right before sleep can get in the way. So I usually suggest close to 3 hours. Finishing your last meal or dessert close to 3 hours before going to bed, if possible. And also drinking alcohol close to bed can be disruptive. Sometimes we don't think about that one because in the short term, drinking alcohol can actually induce sleep, but what it does is it disrupts the sleep architecture. So you're not actually getting great sleep, and it's more likely that you'll wake up after a few hours or have disrupted sleep after a few hours. Lack of physical activity can contribute. Having a sleep schedule that changes a lot, and I see this a lot in people who work shifts, because our minds and our bodies are on a 24-hour, roughly a 24-hour circadian rhythm. And I mentioned before that lack of exposure to sunlight can also be a problem. So, some strategies to improve sleep. As always, awareness is always going to be the first step. So first, recognizing that sleep is a problem, either because you're not sleeping enough or maybe you're having a disrupted sleep pattern. Some quick things that almost anyone can try safely are some sleep hygiene techniques. So first, we want to use, the human brain is one that creates associations very quickly. So we want to use our bed only for the things that we want to use our bed for. So the bed should really be preserved for sleep and for sex. We've already talked about keeping a regular sleep schedule, sometime between 7 and 9 hours. Avoiding screen time before bed, and I'll usually say at least 30 minutes beforehand. You probably want to power down your devices or put them on Do Not Disturb or plug them in not right by your bed. Another thing that happens is if we're not sleeping well, what we tend to do is then try to compensate by going to bed earlier and earlier and earlier, which doesn't often help unless you're truly spending like 5 or 6 hours in bed each night, which is really not enough for the vast majority of people. Instead, what I would suggest is setting yourself up for success. So we want to be asleep most of the time that we're reserving for sleep. So don't go to bed if you're not sleepy. And then in the morning, get out of bed at whatever you decide that your designated wake time is going to be, even if you didn't sleep well that night. And what that does is, because you got less sleep tonight, it really helps build your sleep drive up for the following night. The other thing is, if you're waking up in the middle of the night and you can't fall back asleep, don't lay in bed frustrated or watching the clock, because that can actually be counterproductive and make it harder to fall asleep. So if you're not back asleep after 10, 15, 20 minutes, I usually suggest getting up out of bed, going into a living area or finding a chair, turning on a low-level yellow light, and doing something that's relaxing for you. That could be listening to music. It could be reading some fiction that you have read before. It could be reading a magazine. Ideally, it's not something that is on your phone or on the TV. And you'll find that your sleep drive will build back up eventually. Then you'll turn off the light, you'll close the book, you'll go lay down. If 15, 20 minutes later you're still awake, do the same thing again. And what we're essentially doing is sleep training ourselves into more consolidated sleep. This talk is not about nutrition, but I wanted to give a quick shout out to food and drink, because it really impacts our mood, and it also can impact sleep. In general, this is what we want our plate to look like. And most of us are not getting this right now. In general, for our meals and snacks, we want about half our plate to be nutrient dense with vegetables and fruits. We want another quarter of our plate to be some type of lean protein, which can be, here we see like beans, legumes, these are chickpeas, eggs, tofu. A lot of plant-based sources are here, or it could be a lean protein like a fatty fish or a poultry. And then the fourth quarter should be a whole grain. That could be something like a brown rice, a quinoa, a farro, whole grain toast, whole grain pasta. These are all good options. And many people find, if they're having issues going to sleep, that moving towards this type of an eating pattern actually helps to promote better sleep. I'll just spend a minute to close and tell you a little bit about our Integrative Health and Wellbeing program, because I get a lot of questions about, okay, so now what? How can I learn about these things, or where do I go for more information? And we have a great team. We have actually 6 physicians now who are double board certified in or trained in integrative medicine, as well as either internal or family medicine. Also this week, we have an integrative pediatrician joining our team. Her name is Michelle. We just don't have her official picture here, but older children we're also seeing in our office now. And we have a great team of nutritionists, mindfulness and meditation teachers, acupuncturists, and we have a new massage therapist joining our team in a couple of weeks as well. These are some helpful resources that have good, solid information on them. At the bottom, you'll see our website and our phone number, so we also have links to some of these resources. And if you're interested in learning more, don't hesitate to reach out or call. I guess I'll take questions at this point.
Sorry, I was speaking and I was unmuted, or I was muted. First of all, thank you so much. I thought that was so terrific. I certainly learned a lot, especially about the this is your brain on stress and the more primitive parts of the brain. It's something I had no idea about. So I'll clap for everybody. I know we kind of missed that with the virtual experiences here. And yeah, like Dr. Gupta mentioned, we certainly have enough time to get through a good amount of questions. I did see a couple that came through during the talk here. Can you see these, Dr. Gupta, in the Q&A?
I'm just pulling them up now.
Okay. If you can, I'll be happy to read them.
Yes, I can.
Sure, go ahead.
Great. So the first question is quite specific, about a specific person who had to have their gallbladder removed when she was young, and she's continuing to have recurrent digestive problems, including throwing up. And the question is, she's had a lot of stress in her life. Could those digestive symptoms be caused by stress? That is a really important question. It's also a really, really specific question, and it sounds like we're talking about a really specific medical situation. So I think in order to best answer that, I would suggest we can talk one-on-one at the end, or just consulting with an integrative specialist. The short answer, not specific to the person that you're talking about, is stress can cause a lot of digestive issues, including throwing up, but I don't know that it would be the first thing that I would leap to. I certainly wouldn't want to pin it on that without making sure she's gotten worked up by a gastroenterologist as well. Sorry, that's probably not a very satisfying answer. There's also another question about if the damage to the telomeres reverses itself. So we know a limited amount. What we know right now is probably it's not going to reverse itself, but really early data suggests that people who practice mindfulness and meditation, they might actually increase that activity of telomerase, which is that enzyme that creates the telomeres, which is really fascinating. We don't really have medications or other techniques that do that. So I think it holds a lot of promise. I don't think that the damage, I wouldn't think of it as damage. I would just think of it as less of it. I don't think that it would reverse itself. Typically, those telomeres slowly unravel with age. Another medical question. I'm not sure if I see two questions from the same. I'm not sure if these are related to each other. I'm going to take them separately. The first is, I've had chronic insomnia for years. I've tried everything and nothing helps. What do you suggest? The way that I usually tackle these long-standing, really big problems is to get a really, really deep dive into things that may not have been brought to the surface before. So what that would include is learning a lot more about how you're spending every day, a lot more about what you're doing and thinking about and spending that time doing when you're not asleep, and understanding what even we're calling insomnia, because there are different types of insomnia. And there are also, basic things that you'd want to rule out as well if somebody is not sleeping through diagnostic tests. In general, those are the key lifestyle things, though, that I would think about and make sure we're addressing immediately. So like food and drink. Is there an internal stress response that's contributing? Is it something situational like work or something else that's going on in your life, or something else entirely? And then I see a follow-up question that is about memory, and I think asking if memory can come back. And it really depends on what's underlying that memory issue. So if it's something like if you're referring to that effect of stress on memory or lack of sleep on memory, that short-term memory can absolutely improve if we address that sleep and that stress. So that's absolutely possible.
I see a couple questions came through the normal chat feature, so I'll just go ahead and read those ones in case you can't pull them up. One here is it accurate that chronic stress can damage our thyroid function?
Got it. It's a great question. I definitely see those two things quite frequently alongside each other. One thing that we do know about being chronically stressed is that it can lead to physiologic inflammation, which can sometimes be part of what causes thyroid illness. But there are multiple types of thyroid illness. So something like low thyroid being caused by a medication, that may be less affected by chronic stress. Something such as Hashimoto's, or basically chronic autoimmune illness causing thyroid function to be lower, stress can play a role in how you feel.
Okay. The other one here that came through that function was, what is the impact of sleeping at irregular hours if I still get 7 to 9 hours of sleep a night?
Important question. I think the key thing is if you feel like if you get into bed, you fall asleep relatively easily and you stay asleep for that duration and you wake up refreshed, that sounds to me like you're still getting restorative sleep. I think that's uncommon if people are like doing shift work where they're sleeping during the day sometimes and sleeping at night. But if that's happening for you, then that to me sounds good. And if we're talking just a little bit of irregularity, like going to bed at 10 one night and 11 another night, that's okay. Our bodies and minds are designed to be resilient enough to cope with that type of a change. I was talking more like wild swings. And we're not robots. We can't we can't live a perfect life or live like robots. So to me, that sounds good.
There were a couple questions that came through ahead of time through the registration forms. Actually, many of them were focused on melatonin and either, what you think of melatonin use and the idea of it being potentially habit forming.
Good question. I think, so melatonin is essentially a hormone that our brain releases in order to help induce sleep. And so that is also influenced by a circadian rhythm. Of course, the best answer will be, set yourself up for success so that process is happening seamlessly for you. But melatonin is pretty well tolerated usually. So if you are, for example, fighting jet lag, you need to like reset your sleep schedule more quickly, or if you're finding that if it's helpful for you, then I think you could take melatonin. Most people can take melatonin safely. The dosage that I usually recommend, it's per person, but usually some people respond to as little as 0.5 milligram. And most people, if they're going to respond to melatonin, they will respond to it within 5 milligrams. So I'll usually suggest starting on the low end of that and then increasing it by 0.5 or 1 milligram at a time, taking it 30 to 60 minutes before you go to sleep. And if you find it helpful and it's not interacting with any of your medications, then I think that's okay.
Great. 2 more came through that Q&A box, if you can pull that up. If not.
Got it.
Okay.
Sometimes I feel like somebody's tapping my leg while I'm asleep and it wakes me up and I have trouble falling back asleep. It's interesting. Is there a medical reason associated with sleep that causes this? I would have a lot of follow-up questions for you to understand it a little bit more. It's what I'll say is that's not very common. That doesn't mean it's not real. No specific diagnosis is popping out in my mind, but it sounds like it's worth talking to somebody about. Like a primary care doctor would be the best place to start, and then they may refer you for something else. And another question is, what are the long-term effects of working night shifts? Excellent question. The long-term effects really depend on what you put into place to cope with it. So if for example, so I have many colleagues who work nights, and I even have some who only work nights. So for the last decade, they have been only working nights, and they have a sleep schedule during the day, and then they get back up and they live their life in a way that feels normal or supportive for them. Now it's not ideal, because that person is probably getting less exposure to the sun, especially during the winter months when it's dark most of the day. But you can make that situation workable. I find the most difficult situation is when you're doing a combination of day and night, and you're kind of asking your body and mind to go back and forth between the two in like a 24-hour period. And that can be really difficult, because you can't reset our circadian rhythm working like 2 days and then shifting to 12 hours opposite. Is there anything specific you recommend for teeth grinding while sleeping? Is this stress related? A dentist made a nighttime sleeping device, but not sure if there are other approaches. Stress is probably the most common cause for teeth grinding. Sometimes we're aware of our teeth grinding, like you're aware of it, or your partner or spouse calls it to your attention, or your dentist notices that the enamel is eroded, or you wake up and your jaw or your neck is tense, and you don't have another reason for it. So it can manifest in a lot of different ways. Not knowing you and not knowing your medical history, that would probably be the most likely scenario. And the night guard is probably the best treatment, in addition to addressing the underlying cause. So anytime there's a problem, I'm always going to recommend addressing the underlying cause. And so if we're thinking that it's stress, then we need to build awareness around it and understand why and when it might be playing a role, and then figure out how to create a supportive environment for yourself through various of the techniques that I suggested, and maybe others that you have already. And I might suggest incorporating those things, especially in the evenings before you go to bed. Techniques like journaling can also be a great way to kind of download your thoughts before you lay down, so that you're not carrying them with you to bed. You know, sometimes when you have a really long to-do list before you go to sleep, it can kind of play like a record, like I have to do that, I didn't get to that today, I need to do this tomorrow. And it's far more productive if you can write them down on a to-do list, like I'm going to address this during lunch, I'm going to think about this after work tomorrow, and then put it away, because we're not going to be productive at night.
It makes a lot of sense. Yeah. Some more questions that came in before the talk. A couple surrounding sleep apnea. So how, do you have strategies for, getting good rest or good sleep with, having sleep apnea?
The most likely reason to not be getting great sleep is if it's not titrated properly. So you want to, if you feel like you're allowing enough time for sleep, and your sleep is not fitful or restless, then the first question to ask your sleep doctor or neurologist or ENT doc is, do I need to be tested and have a sleep study with with the machine to make sure that it's at the right settings. That would be the biggest thing. Other things that are often issues with people using CPAPs is the comfort. So if you've had your machine for a long time or the equipment for a long time, it's also worth asking your provider if there's newer equipment, because a lot has come out in the last couple of years, including masks that don't cover your entire mouth, including better straps, and there are even other more focused masks that are right for some people.
So I have a couple others here that I could definitely ask, but if there's anyone else on the webinar that wants to throw a question in the chat, please, by all means. But for now, I thought this was a pretty good one. How does your sleep change with age?
It's important to know, right? Your sleep definitely changes with age. Early awakening can happen a lot. So if maybe you're somebody who is used to waking up at 8 a.m. each day, at some point you might find that you're naturally awaking earlier. With that often comes people going to bed a little bit earlier because they notice that they're waking earlier. The other thing that can happen is you can have more disrupted sleep at the end. But if you're talking to the right people and you're adjusting your sleep interval appropriately, you can still get as much restful and restorative sleep. And I say that because you get most of your restorative and deep sleep in the first few hours of night. So like, let's say this is you going to sleep. You probably have heard that you go through approximately 90-minute REM cycles. Sleep cycles, and in those in those first like 2, 3, 4 cycles, you get most of your restorative sleep. Later on in the night, those actually get shallower and shallower, so you're actually getting less restorative sleep. So even people who sleep, for example, 5 hours are probably getting the majority, but not enough, but the majority of their restful sleep.
Another one came through here. Is it better for you to sleep on your stomach or on your back? Any advice on how to switch?
If you figure that out, let me know. That is really hard to do. I think for like ergonomics, I think that in general, sleeping on your back with an appropriate pillow is probably going to be the best and the easiest on your body. When you sleep on your stomach, unless you have like a hole in your pillow, which is interesting, most of us probably don't. You can see how your neck is twisted close to 90 degrees, and that does put pressure on the vertebrae in your neck. That doesn't mean, I mean, there are a lot of people who sleep on their stomachs and make it work, so it doesn't mean that something bad is going to happen. But if you're noticing that you wake up with neck or shoulder or jaw tension and you're a stomach sleeper, it's not a bad idea. There's a new device coming out every day. It's worth taking a quick look and seeing if there's something that'll vibrate as you shift position, or even putting up blockades for yourself the first few nights, or asking if you sleep in the bed with a partner or spouse, asking that person to help you out. I don't have a great answer for that part.
Yeah, I think that's tough for everybody that's ever trying to kind of switch. Yep. There's another one there if you see it.
What do you think about sleep apps for determining if you're getting good sleep? I think it's a really good way to start getting aware of your sleep patterns. So kind of in that vein of devices, there are a lot of apps that will look at it. An Apple Watch will give you some cursory information. Fitbits will give you some cursory information. Aura, I don't work for any of these brands. I'm not affiliated with any of them. But Aura, O-U-R-A, will give you some information. And they're all really great ways to be more aware of your sleeping patterns. I think it's a great way to get started. There's also, I'll just mention one other thing that can often be driven by an app. Cognitive behavioral therapy, for somebody like the woman who asked that question earlier. There's a lot of evidence behind cognitive behavioral therapy in the context of insomnia, because if you've tried all of the basic and traditional things and nothing is getting better, that might be a worthwhile option. And there are apps for CBT for insomnia. So there's one site called CBTI. There's another one called Sleepio, and I think both also have app interfaces. You can also use a simple like sleep diary, and there are a ton of those in any app store, where you just record your sleep. Again, that accomplishes the first step of awareness.
Yeah, there were definitely a couple questions people had about apps, so I'm glad we got to those. I had a question for you. So, you know, and this is probably everybody can relate to this that is in any kind of professional working environment, but lots of meetings sometimes, and there is kind of that feeling of go, 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 right? And, you know, you mentioned, you know, some meditation and some kind of breathing exercises, but do you have maybe sort of a quick one that you would suggest, or a quick strategy for, let's say, starting a meeting? Let's take the first 2 or 3 minutes of the meeting for everyone to really just, let's have some deep breathing or some guided meditation or something. I mean, for somebody that's not a professional, right? That isn't even super knowledgeable in kind of how that would you know, go down. What do you suggest?
Yeah. One that's extremely quick and easy and that accomplishes what you just said is called 4-7-8 breathing.
Okay.
And those numbers refer to seconds. So, or really any unit of time. So if 4-7-8 feels too long, you can shrink it to what's comfortable for you. But the idea is you'd inhale for 4, you hold it for 7 seconds, and then you focus on a long exhale over 8 seconds.
Wow.
And so if you add that up, that's less than 20 seconds. And starting a meeting with, let's say, 3 of those takes 1 minute. And it is pretty certain that you and the group will be in a different space than you were a minute ago.
Oh, I will be trying that tomorrow. Thank you. We have a couple minutes left. I do see another question in there. Might be the last one you can address. Let's see.
So many books are more available virtually, meaning screen time. Is that counterproductive to getting to sleep or back to sleep? Great question. You know, devices like, for example, Kindles or things that have that paper type effect that are not, that emit less blue light or short wavelength light than traditional devices, even with the filter on. If you're not finding that's disruptive to your sleep, then that's fine. I think, like I was saying before, we can't be robots. If that is something that's easy for you, you enjoy it, and it's not bothering you, that's okay. On the other hand, if you find that after you do that, or after doing that for a while, you don't want to go to sleep, or you go to sleep but then wake back up quickly, or you're fitful or restless for the rest of the night, then I would explore changing that device out for a paperback or something and seeing how that goes. Yeah, I think zooming out, maybe to close, and a follow-up, is it okay to do meditation in the bed? So in an ideal, it depends. If you're using that practice to fall asleep and it's working for you, then that's fine. I would think of that one as a tool or a skill that you're using to sleep better. If that's not the goal for you, if your goal is to create a meditation practice and you decide, okay, I want to practice for 10 or 15, 20 minutes a day, then you probably don't want to fall asleep 5 minutes in. So in that situation, I would suggest still being comfortable. You can still lay down or you can sit up, but maybe not in the same place that you're going to sleep. Yeah. But maybe to bring all of these questions to a close, which are great questions. This was a really, really nice discussion. I would say, in order to keep things simple, like when we look around the world at communities where people live long, but they also live well, like it's not uncommon for people in those communities to live 2 or past 100 without being disabled. Those people in those communities tend to do 4 things well. The first is they eat and they drink well. So diets with lots of vegetables, lots of fruits, whole grains, healthy fats, lean sources of protein. The second is they incorporate movement into everyday life. Maybe it's walking to school, dropping off the kids somewhere, going to visit a family member, walking to a friend's place, or something else, going to the grocery store on foot or on a bike. Third, they feel like they are able to roll with the punches of everyday life. So I'm not talking about big losses. I'm talking about everyday challenges that come up. They feel like they can deal with those. And the fourth is they have a solid community. That community is commonly a spiritual community, but not always. It can also be a purely social community of family, of friends, of colleagues, even acquaintances, neighbors. So that doesn't mean if we all do all 4 of those things, we're going to live forever. But I think it's the right place to start when we're talking about how to live daily life.
Oh, well, thank you. That was a beautiful bow to put right atop this package you delivered for us this evening. So thank you very much. It's always nice to hear you speak and hear your story and what you're all about in integrative health. So for everyone left on the Zoom, again, I'll be sending out the recording tomorrow at some point. And then if you had follow-up questions, you'll have my email address, and perhaps I can facilitate a discussion or, an email between you and Dr. Gupta, if that's okay with her, if you have anything for her. Okay, so thank you again, Dr. Gupta, and thank you everybody for your time and attention.
Thank you all.
All right, have a good night.
You too.